What's going on, guys? Today I want to talk to you about supplements, specifically with the Safe Sleeve. As you know, the sleeve is a tool, not an absolute solution, and with this tool we establish a foundation of balance and the right food choices for long-term success. But although the sleeve does not yield malabsorption, and even if you make the right food choices, the restriction is still great enough to put you at risk for deficiency without supplementation. So bottom line, supplement. Okay, so here are our top 5 recommended post-bariatric surgery. Multivitamin, calcium citrate, probiotic, omega-3 fatty acids, and B complex. If you've had surgery with Blossom, you are not required to start supplementation for 2 weeks after surgery. To be clear, this is not a requirement, it is a recommendation. You are to prioritize your prescription medications. Supplementing right after surgery may just be painful, okay? So let's break it down. The number 1 priority post-bariatric surgery is the multivitamin. I do recommend a bariatric multivitamin because they are already formulated for bariatric surgery. Some vitamins and minerals are elevated compared to what you'd find over the counter. So why do we need vitamins and minerals? Simply put, they are the catalyst to metabolic function and the fuel that allow the cells and nerves to communicate, grow, and function. Without them, your body would not be able to function properly. I don't expect you to tolerate the supplements listed by day 14, okay? You will progress as tolerated, just like solid food progression. But if you can only tolerate one thing, it will be the multivitamin. There are 2 options I recommend for consumption, and that is the capsules and the chews. Bariatric brands now carry 1-a-day capsules. I recommend this because they are more cost effective and more convenient. You can even open up the capsule, toss it in a shake or a soup, and it will make things easier because it is drinkable. One consideration is that you can purchase this with or without iron. If you are not anemic, you can take either. But check with your doctor to confirm, because if you are anemic, or on the lower end of that range, it's better to take with iron. Caution, supplementing with iron can cause constipation, so keep the hydration high, fiber in the diet, or you can supplement iron separately in smaller doses, okay? So that's multivitamin. Number 2 priority is calcium. Calcium citrate is preferred because it doesn't require stomach acid for absorption, as opposed to calcium carbonate or a blend. Now, we tend to just associate calcium with bones because mom always said, drink your milk, get strong bones. Yes, calcium is extremely important to prevent osteoporosis, but not only that, it's required in almost every cell in the body, your nervous system, muscle contraction. It's even required for nerves to send messages to your brain, okay? Recommendation, 1,500 milligrams, but your body can only absorb roughly 500-600 milligrams at a time. So no matter what brand you choose, you will have to take multiple times in a day. And if you've ever taken calcium before, you know that a 500 milligram tablet is like a horse pill. So for that reason, I do recommend the chews for calcium, which make them so much easier to swallow. Not to mention, you get a little sweet treat, but you are more than welcome to gamble with those horse pills. You do have options, so choose your battles. Okay, so the remaining 3 recommendations, probiotic, omega-3 fatty acids, and the B complex. Collectively, these are important for your metabolism, overall wellness, your immune function, and are very important, surgery or no surgery. There are a ton more benefits to consider with these individually, but I'd have to do a separate video on these individually, otherwise the video would be an hour long, so let's keep it simple. Another consideration, cost. If cost is an issue, these 3 are secondary to the multivitamin and calcium. So what I'm saying is prioritize the multivitamin and calcium and introduce as tolerated. So as for brands, I do recommend bariatric supplements because again, they are formulated for bariatric surgery. We're talking about dosing and convenience. If you follow the label, it is more likely to be in accordance with the ASMBS guidelines, which is the standard in medicine for bariatric surgery. And when I say convenience, these companies factor in the difficulties related to eating, so you can pretty much find anything in a chew form or a more tolerable size. Based on that, your choice becomes personal preference, okay? If you are loyal to a brand, you don't have to be unloyal to your brand. Just keep those in consideration. We use Bariatric Advantage here at the clinic because they taste good and their testing is very transparent. Okay, other companies to consider, Bariatric Fusion or Celebrate, both are very good brands. Another option you have are the patches. The patches don't even touch your gut, so you can start them all from day one. But patches are not as good as oral. I only like them in the beginning because something is better than nothing, and in the time period you are navigating towards introducing solid foods, I'd much rather you focus on introducing solid foods. But if you do use the patches, I do recommend switching to oral at least a month later to make sure you are getting the best absorption of these nutrients. I'll leave a couple links below for your convenience. Bottom line, I don't care where you buy, okay? As long as you are compliant with your nutrition, we want you to succeed. Remember, compliance is the science. I'll see you guys in the next. Peace.